Good morning, everyone. It's Dr. Brace here, and welcome to Facial Plastic Fridays. We just finished a series on filler. I hope you enjoyed it. Now I'm going to move into some more surgical topics, and today we're going to start with the lip lift. This is probably one of the fastest growing procedures in terms of popularity in the last year. It's a very powerful procedure. A lip lift used to be thought of as something that you would do on somebody in their 70s or 80s who had a long, elongated, kind of aged upper lip with lots of wrinkles where you could hide the scar. But because of some advances in how we do this surgery, it is now a procedure that's done on women in their 20s all the way up into your 60s, 70s, 80s as part of either a facelift or a procedure on its own. And so one of the reasons for the growing popularity of lip lifts is that filler is so common. And when you put filler in somebody's upper lip to give them more volume, you're also adding mass to the lip. And we all know how gravity affects mass. If you make your lip heavier by making it bigger, it's going to pull it down. And with time, if you do lip filler over and over and over again, 2, 3, 4 years, starting in your 20s, you'll notice that your lip starts to look different. It starts to look longer, heavier, off balance, and not necessarily better when you put filler in your lip. It will look bigger, but not necessarily better. And so one of the things I'm seeing more and more of is women who are coming in and who have what we call filler fatigue. They're done with doing filler in their lip. They just want their lip to look larger without looking heavier or longer, because a longer upper lip that covers your incisor teeth, the front teeth here, makes you look aged. One of the features of a young face is that, as I talked about with filler, it's widest or has the most volume in the middle third, and in the lower third it tapers and has less volume. And so if you have a longer upper lip and a fuller upper lip, you're adding mass and volume to your lower third and you're making your face look older. And so it may look different, but not better with filler. So what do we do? Whether it's for filler fatigue or just an aging face, I would dissolve out any filler that's in the upper lip. And then what we do is something called a modified upper lip lift, sometimes called a deep plane upper lip lift. My colleague, Dr. Ben Tale in Beverly Hills, I got to know Ben when he was a fellow with Dr. Giacono in New York. Got to stay with him in his apartment and had lots of fun with him. I visited him in Beverly Hills as well. He is really the pioneer of bringing back the lip lift, especially in young women and young people. He's described in a paper recently the deep plane upper lip lift, where we're releasing the lip SMAS, which is different from the SMAS in the face, off the orbicularis muscle so that we can lift the lip up, get more vermilion show without it looking pulled or funny or like a rabbit, which is what a lot of people are afraid of with a lip lift. And so what does it involve? It involves a little bullhorn incision right underneath the nose, and I'll show some pictures of this. Removing a strip of skin, and how much skin we remove is different on every person. There's some textbook numbers for how long an upper lip should be, and we would take the appropriate amount for the age of the person to make their lip look balanced. You don't want to do the same thing on every person, obviously. It has to be individualized. And so we remove that skin, we release the skin and the SMAS from the upper lip muscle, the orbicularis muscle, and then we suture it back up to the upper part of the incision under the nose. So the scar ends up hiding right underneath the nose. And what we're looking for here is a shortened philtrum, or the white part of the lip, more eversion or outrolling of the vermilion or the red part of the lip, and just more balance to the face. And so I'm going to show some pictures here. This is some intraoperative footage of what a lip lift looks like on the table, and I'll show some fast forward footage here. And so you can see that we're removing the strip of skin, and then I elevate everything, and then we bring it closed. The stitches stay in for 6 or 7 days. We use little teeny tiny ones, and once they're removed, starting about 3 to 4 weeks, we start lasering the incision with a pulse dye laser, and sometimes we do CO2 laser, but the end result looks like this. And I'll show a series of upper lip lifts here. And you can see that we are shortening the upper lip to make the lower third of the face look smaller, and a smaller lower third of the face is more youthful. The more tooth show you have, the more youthful, to a point. You don't want it to look like a rabbit, but the more incisor show you have, the more youthful the face looks. And so that is an upper lip lift. It can be done under local anesthetic. So it's rather a simple procedure to do, and it's a very powerful procedure to add on to something like a facelift or to do on its own. So I hope you enjoyed that. Send us your pictures, send us your questions. Everybody have a great weekend, and happy Facial Plastics Friday.